we know of tragic histories like the Tuskegee experiments, which have infused in these communities of color a deep distrust of these types of activities. And ironically, in this case, we also know that overall, different outcomes in the healthcare system, worse outcomes for immigrants, people of color, are bearing themselves out in this pandemic as well. And yet, those are also groups who could most benefit from a therapy that they could get on in a study. So we really would like to improve that situation. Of course, working in multiple languages helps. Accessing sources of authority in those communities, like pastors and ministers in the Black church community, we're doing those things, helping with family relationships. We have a new initiative we're starting to really recruit investigators that are people of difference, so that if my doctor looks like me, I might have better trust in that system. And then finally, going to where the patients are is a vital thing. Classically, drug companies, we get more comfortable when we go to the renowned institutions that you would know about, Harvard Medical School, Stanford. Those are fine institutions, and we do a lot of studies with them. But increasingly, we need to get into the community. Interestingly, in the what we call the ambulatory study, where people are diagnosed and walking around, and we're treating them within 3 days, hopefully, we didn't have much success in those famous institutions in recruiting. Where we found most our success in enrolling that study was in the community clinics, local hospitals, county hospitals, which brought us into a more diverse place. So I hope our studies are more representative than others of the population affected. I'd be surprised if we were all the way representative of the disease impact because of these barriers. And I think we're learning from that, and it's teaching us we have more work to do studies that look like the communities we're serving, which is our goal.
You talk about the mistrust barrier that has grown, especially in the Black community, because of its treatment by the medical community over the years. Do you see signs of that lessening, or is that as big an issue as it ever has been?
I think it's similar to what it's been. I think what's new.
Long way to go.
I think there's a long way to go. And I think what's new is a concerted effort by industry and, frankly, the community health systems to really address that. Because the only way to get a medicine that is designed for COVID right now is in a clinical study.